Hello my people, Phyllis here again. Remember, we are still here doing a series, and today we are lucky to tell you what we do in Moses Basket Initiative. Many people ask what are our components. We have discussed severally what components we have in Moses Basket, so that unaweza elewa, you can be able to understand and follow us, so that you can be able to understand the kind of work we do. So one of the components we are going to discuss today is the health component. Now this is quite wide because we chose health component because it is the backbone of Moses Basket Initiative. So here we are talking about menstrual health management as a subtopic in the health component, because in the health component we are looking at four things. That is infant mortality rate, that is part of our health in the component. That is the baby package and the safe motherhood package that we have inside the health component. Then we have what we call the SRHR, sexual reproductive health, where we teach on various topics that we are going to discuss in the next video. But in this video, nataka muelewe what is menstrual health management and why is this topic very important to us. And one of the reasons we are talking about this topic is because that in all our work in the community, it revolves around girls menstruating. And I keep saying, if we can't talk, kama hatuwezi ongea about menstruation, about periods, wazi, in one way or the other, very frankly, to the young people, to the teenagers, to the children, to the men, and to the women, then we are failing, because it is the backbone of our society. Ebu angalia all cases that we have. Why do we have teenage pregnancies? Watu wali have sex, were irresponsible sex. Why do we have women having children wanasema this is unwanted pregnancy, I want to abort? It's because they didn't understand their menstrual cycle, or because of other reasons. Mwanaume anasema, oh, I have children, oh this woman did ABCD. Why do I have a child that I don't know? We had sex only once and now we are having issues with the pregnancy. That man means that man doesn't understand the menstrual cycle and how it works. So it is the backbone, because women are raped because of their menstrual, because they don't understand their ovulation, they don't understand the menstrual cycle, they don't understand anything about their body. And that is why we have issues in the community that we are trying to address as Moses Basket. Lack of sanitary pads, which has been there in many years, and we are in the 21st century, but still the issue is there, because you can find girls without pads, and that is one of the issues, that they're exchanging sex for pads, they're exchanging sex for food, they're exchanging sex for all these things, because they lack the basic needs, and it's painful. It's not something that we love to have it in our society, but it is there in every aspect of our life. We have this challenge of menstrual health management. So here we talk about our periods, how they work, how women are, and how the uterus works. Because once we understand the uterus, we understand the fallopian tubes, we understand the ovaries, we understand about the ovulation process, we understand how we have the moods, we have the hormones, it's a whole complex thing that goes around in a woman's body for 28 days. Men take it lightly, but it's not, because women are menstruating all through in the cycle. We have different phases in the cycle. We are going to look at it, how we move from one phase to the other, one phase to the other, one phase to the other. And that phase means that we are menstruating in the whole of 20, because once you finish your period, that's why it's called a cycle. That's why we have a cycle. It's a circle. So it means it's not ending in any aspect. It's going to go in one bit, like in 4 days you're menstruating, in 4 days another thing is happening. So hakuna shortcut kwa hiyo cycle. So we move, and that is what happens. So menstrual health management is something we want to look at as Moses Basket. We want to ensure our girls have enough sanitary pads, so that we are not able to have the issues of exchanging anything, sex or rent or food, for sanitary pads. We want to talk about menstrual health management because we want schools to have enough facilities for the girls, because when you talk about menstrual health management, we want to see the toilets for the women, because girls are menstruating. So if they don't have enough washrooms in schools, if they don't have small things that we look at, like the bins in schools, zile za kutupa sanitary pads, that's why we'll find sanitary pads all over in every other street. Zinakuliwa na mbuzi, zinatupwa kwa takataka, because the management the part of management has not been handled, the part of where women feel that they have incinerators in schools where they are disposed nicely, or good latrines that the sanitary pads can be disposed inside there. And remember, these disposable sanitary pads, they are not recyclable, so they are there in the environment, and they're going to spoil the environment. So when we talk about menstrual health management, we are looking at it in the all aspect of it. The maintenance, how do they maintain their own hygiene? How do the girls... How do the girls maintain hygiene that is classic when they are menstruating in schools? Remember, unaweza pata a big woman like me who is at 40, but there's that young girl who is 10, 11, 12, who is still scared and doesn't know how to handle themselves during their menstruation cycle. So that is why we will go to those schools. We will go with our program there and train the young girls on menstrual health hygiene, because we want them to be women who are responsible, who are clean, who understand their bodies, who understand their cycle, girls who have knowledge. And we'll also train the boys in this school, so that when we are telling them to stay away from the girls, they can be able to see the whole uterus, how it works and how it is, so that when they are going to have irresponsible sex, they know that these girls can get pregnant in one night, in one sexual activity. So in schools, we target schools mostly, where we go to these schools and we train on menstrual health management, and we train the girls and the boys together. We look at the women and men in the society. We also train them on menstrual health management, because they are the family setup. They are the ones who are bringing these children to the world. They are the ones who are having these children. And women in our communities, like in Malindi, in Marsabit, in Narok, our women are not so empowered like in Nairobi or anywhere else. So they're giving birth every other time, they're giving birth every year, they're giving, so that they cannot be able to see their blood. Why? Because also their men don't understand that once we finish our menstrual cycle, it begins again and we can get pregnant again in one. So they're bringing to the world children, and they don't understand how the cycle and the management of menstrual cycle needs to be done. That is why it is a key component in our health. In our health component, menstrual health management is one of our biggest seeking solution on training and advocacy, so that we are able to reduce the teenage pregnancies, we're able to reduce the children pregnancies, we're able to reduce a number of children in the families, so that one family is not having 12 children who are not able to take care of, and they're able to take care of the young girls or the young children that they have. So if they have 5, that's enough. If they have, but don't go beyond 12 or 13 children and you're expecting that they will have quality life. So we look at it from that, because we want all children to have quality life by people being responsible at the menstrual phase, at understanding the periods. We know it is a taboo in this country to talk about them. Men don't want to hear about it. Women don't want to hear about it. We close doors and say, okay, let's discuss it in another time. In our churches, we don't want to talk about menstrual health management, because we think it is a taboo. It's not a topic that needs, but actually it is our daily life. It is what it is every other single day. So we can't stay and say we can't talk about it. This is us, this is who we are, this is what the problem. Anasema without conception, without women getting pregnant, it is the beginning of life. So if a woman is not going to menstruate, then we don't have life. We don't have anybody looking at tomorrow. So we have to be very careful when we are discussing these topics, so that we are able to understand that without menstrual cycle, you and me cannot be here. Our mothers had to menstruate for us to be here. It is something people don't like hearing, things that people don't like, but these are topics that we need to discuss in the community where we are, and address the issues that we are facing, and address the core problems that we are having, so that hizi mambo mingi that we have, the community issues that we have, we can be able to reduce. It cannot end, but completely, but we have reduced, and our people have enough literacy level. They have the correct information. So if you are a nurse there, if you are a doctor there, if you are a gyna there, join us in this topic so that we can be able to discuss these topics wider and better, so that we can be able to understand each other well, so that you can be able to help us as we ask you questions on menstrual health management in our show, so that we are able to move together. So join hands with us and move with us, and make sure also, if you are our subscriber, thank you so much. Continue watching. And if you are new here, make sure you subscribe, like, and comment, and share in our YouTube channel, Phyllis Shiko, and Moses Basket Initiative in TikTok, Instagram, and Facebook. So look for us, and let's walk together this journey as you're able to understand Moses Basket Initiative, what we do and how we do it. So asante sana, karibuni tena. We love you guys. See you in the next discussion.